Yes, go ahead.
I want to announce that March is Developmental Disabilities Awareness Month, and Governor Roy Cooper has issued a proclamation for it. I sent the proclamation in PDF format and in an accessible Microsoft Word format to Lori to share with all of you. So the North Carolina Council on Developmental Disabilities is excited about that. We received the proclamation last week, and then right after we received the proclamation, several people at the city of Raleigh contacted us about hosting or helping to host a Developmental Disabilities Awareness Month event. Let me see. It was Angel, a woman named Angel, and a woman named Karen Evans contacted us. And basically, they would like to have me moderate a panel of individuals with developmental disabilities and City of Raleigh employees. And this event is scheduled for March 25th, which is next Thursday from 10:30 to 11:30. We don't have an official flyer ready yet to advertise it, but when we have something, I'll send that to Lori also. But we have Chris Hendricks, who's a person with a developmental disability, and our public policy coordinator for the council, serving on the panel. We have Kay McMillan, another person with a developmental disability who graduated from NC State University, and she's a current council member. And Gerald Parrish, who is the Community Inclusion Specialist at the Alliance of Disability Advocates, participating as a panelist. We also have Nikki Spear, the Program Director for the City of Raleigh Parks, Recreation, and Cultural Resources Department, and Karen Sperlin, who works for Employee Relations in the City of Raleigh. They will be panelists for the event. Also, Chris Hendricks, if some of you might have heard that name before, is a musician. So he plans to share his musical talent. So whenever I have any more information about this, I will share it with Lori. But we are excited as a council that the City of Raleigh wanted to partner with us in doing something to recognize Developmental Disabilities Awareness Month. So thank you. That's my report.
Okay, thank you very much. Treasurer's report.
I don't see Sharon on the call, but Demetrius did send the treasurer's report. We have a balance of $4,688.03.
Okay, thank you very much. And Secretary's report?
I have nothing further to report, and there were no comments about the minutes, so I assume that they were acceptable.
All right. What I want to move forward here pretty quickly on before we move to our presenter for today, this is in reference to the an email that Laura shared with me about one of our scholarship awardees is not able to take advantage of the scholarship, so that leaves $1,650 available. And she brought to my attention an email request from Arts Access, I believe was, requested our support of their efforts. And I think that it would be great if our remaining budget could be amended to reflect, instead of the 2 organizations that we previously approved, that we would add the Arts Access into those, and so that those remaining dollars can be divided equally among the 3 organizations. Do we have can I get a motion to that effect?
Ricky, I had another thought of another worthwhile entity, and that's the NCCRS, North Carolina Reading Services.
Yeah. Okay, well, okay,
Well, I was thinking maybe the 1650 we could divide between Arts Access and NCCRS rather than changing the motion that was passed last month.
okay, all right, all right. Give me a motion to that effect,
Okay.
and then we will entertain that.
Okay, I'd like to make a motion that we split the $1,650 equal between Arts Access and NCCRS.
Okay, do we have a second to that motion?
I second.
Do we have a second? All right, so we have a second. Do we have any discussion? Any discussion? Any discussion?
Dr. Scott,
Hearing none. Yes,
Dr. Scott, sorry,
yes, Mr.
I was muted. I having the privilege of sitting on the board of Arts Access. I'm grateful to receive it on its behalf, and this is we're in the midst of our series of fortunate events. As most of you may know, that money, if approved, will be greatly received.
Sure. Well, thank you very much. All right. All in favor of the allocation of this $1,650 to be divided between Arts Access and the NC Reading Association, let it be known by saying aye.
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 Aye, okay. Any opposed? Hearing none, motion carries. So we will get with Mr. Edwards about the appropriate information that he needs in order to make sure that all of these organizations are in receipt of these resources at the appropriate time. Thank you all very much for your support, and we are certainly continuing our work, and y'all's support and all of that is always appreciated. And so now today we have a guest to come and present to us, Ms. Sharon Banks, who is the ADA coordinator for the city of Raleigh. And so Ms. Banks, with no further ado, I think the floor is open to you.
Hello to everybody. Hello, Dr. Scott. Thank you for the opportunity. I don't feel like a guest though. But anyway, you wanted to discuss a little bit about the role of the ADA coordinator. You also want to know about the transition plan, its development, as well as what's happening now. And so I decided we may or may not have those on the call who may or may not have history or some background. So I decided to do some background history, the role of the coordinator, as well as a transition plan and its updates all together. So I hope it doesn't confuse anybody or throw you off, but here we go. The Americans with Disabilities Act, which is commonly referred to as the ADA, was signed into law by President George Herbert Walker Bush, that was the first Bush president, on July 26, 1990. It is enforced by the Department of Justice, referred to as DOJ so many times. The ADA standards and regulations have been written to be used as a guide to determine whether employers are compliant. It is also a civil rights law that has 5 entities and many components. Title I is human resources. Title II, state and local government. Title III, commercial, which is hotels, for instance. Title IV, telecommunications. Title V is miscellaneous. The ADA also has other regulations that pertain just to transit or transportation services or provisions. As a local government, the city of Raleigh is considered a Title II entity. However, Title I does address human resources and those practices. The ADA is sometimes considered an inclusion act. Those persons with disabilities, regardless of what that is specifically, want to be included, just as all of us here in this meeting now today want to be. So the one thing we must always remember is inclusion. The ADA requires any employer with 50 or more employees to have an ADA coordinator. The ADA coordinator's role is to make sure as much as possible that the organization is compliant with the Americans with Disabilities Act. It also strongly suggests and supports certification of the coordinator. And in this case, that the individual becomes very familiar with those employed with their organization and very familiar with the requirements of Title II. The coordinator is encouraged to attend the National Symposium, to receive all the training that they are interested in getting or feel that they need. The National Symposium is a wonderful, wonderful network. It's an opportunity for people from all over the world, not just this country, but all over the world to come and share, network with each other, and just, it's just such a wealth of knowledge there and experience there. And it also serves as a support and an encouragement for those of us who serve as ADA coordinators or in other organizations in some other role related to the ADA. Philip Willett has had an opportunity to attend, and it's just been great. The city of Raleigh is considered a fairly large Title II entity, and our organization is fortunate to have others on board who are point persons for their departments or divisions as it relates to ADA concerns. What are we at the City of Raleigh required to do? As an ADA Title II entity, we have 7 steps to follow to implement the ADA for our organization. Step 1, start implementation. Step 2, appoint an ADA coordinator. I was appointed in September 2012 and later became certified. Step 3, provide notice. That's providing notice to the public that we are undertaking this project, and we want to have feedback and input from them. Step 4, adopt a grievance procedure. The City of Raleigh's can be found under accessibility on our website. Step 5, conduct a self-evaluation. Ours was done in-house by employees. Step 6, develop a transition plan, which states all results from the self-evaluations. Step 7, create an action plan. How will we remove the existing barriers? How much money will it cost? So we project and forecast. And we know that changes all the time. From week to week, even in the grocery store, that changes. So we forecasted, but sometimes it has to be changed. We forecasted even with an inflation, but it sometimes still has to be changed, modified. And then the time and period in which these barriers will be removed. I requested all department directors to designate representatives from their departments or divisions who would work and serve on the ADA team. We met, provided some training to give them an introduction and background to help employees better understand the task they were about to undertake. While we've had the Mayor's Committee, we've embraced disabilities, a lot of our employees still have not been exposed to, have not gotten the proper etiquette and what have you. So we did the background training and overall training overview of what was to be expected and why. Our employees were concerned that their existing work duties and responsibilities might be affected or impacted with their involvement in this process. So they were leaning more toward an outside consultant to do the work. I was more concerned about the fact that we had done some things, perhaps not properly recorded, but we were aware of what had been done. And we needed to stay involved, even if we did go that route with a independent consultant. So I encouraged them that if we did go that route, they still need to strongly consider staying involved and engaged, answering any questions, sharing any information they need to share as to why we did this, that, or the other in their individual departments. So they were also made aware that self-evaluations would have to be conducted for all facilities owned or leased by the city of Raleigh. They would also have to do self-evaluations on parking lots, grounds, and programs alike. After discussions with our team, I asked them to please consider working closely, and we at that point had decided to go outside, hopefully, with a consultant. Using the assessments that we did allowed us to cut costs in having that consultant group write the transition plan for us. We also allowed them to reassess or reevaluate some of our facilities, some of the things we had done, so they could compare them, as well as point out things that may have been missed by our employees. And that was a win-win. So we decided that we would conduct all necessary self-evaluations, and the information would be used by an independent consulting group to revise and rewrite the transition plan for the city of Raleigh. It also entails evaluating current services, policies, and practices for those items that do not meet requirements for the public. The public was invited to participate in the self-evaluation by submitting comments and or providing feedback. We were very fortunate to have a new staff hired. Echo Dowling Swansea served as the compliance manager at that time in engineering services. And after joining the city, she attended her first symposium and came back, hit the ground running to begin the self-evaluation process. Additional meetings were held with the full ADA team and others. With the use of the above information, a revised written transition plan would be developed. The City of Raleigh's transition plan was completed by Altura Consultant Group out of Austin, Texas, and presented to us in October of 2019. The transition plan is a formal document outlining the city's compliance with the ADA. The transition plan is a living, never dying document. It is a formal document that lists all barriers that have been identified with a projection date as to when they will be removed. Realizing that budgets factor into the removal process, the DOJ does not demand removals immediately, but it does require that that acknowledgement and projected dates and times for the barriers to be removed in each case. Whether it is a too narrow sidewalk, improper sidewalk closure during construction, removal of doorknobs and replacing with levers, handles, or whatever has to happen there. Too high countertop in an office where someone in a wheelchair is transacting business, a commode that is not raised high enough, a restroom that doesn't have the proper 36-inch turnaround, whatever it is, all of that has to be acknowledged and written into the transition plan. Our transition plan allowed us to start removing barriers in fiscal year 2020-21, which is the one we're in now. Unfortunately, the pandemic came about, and the protests that occurred in Raleigh during last spring. And those two things prevented many of the barriers that were scheduled for removal from being removed. However, we are now getting back on track and trying to pick up where we left off, and again, correcting and removing some barriers as noted in the transition plan. Some policies have been revised. Others have been or soon will be developed and reviewed by our HR department. Their staff and others will be involved as well. More training will be made available and mandatory for employees, hopefully later this year. The essential functions and duties of each position advertised will be reviewed very carefully. Disability policy will be written. Reasonable accommodation policy. Both those have been drafted, have not been approved yet, but they've been drafted. And so we're moving forward with policies being written as well. We're looking at things in job descriptions that require maybe a Class C driver's license. And we're looking at how much driving is actually done. If that Class C driver's license really does need to be a part of that description. And so we're looking at jobs prior to them being advertised more closely so that somebody's not automatically assumed automatically that they don't qualify because they don't have a Class C driver's license. When in actuality, we may be able to do something different and the Class C driver's license may not be an essential thing there. So we're looking at those kinds of things and others as well. We have a department who's doing a temporary modification. They're doing a temporary modification because they're slated to have a new facility built. And as a result of that, they don't want to put a lot of cost, a lot of money into that modification right now, knowing that a new building is going to come, and sooner rather than later. So they have done modifications and made accommodations to make things safe for that particular environment. I want to again say a big thanks to ECHO and the ADA team for all of their hard work. They're still doing things, they're still working, making all these transitions of these barrier removals, getting them completed. So, and it is so amazing to have been with so many of those people from the beginning and where they are now. And it was simply because of not having the understanding, not having the knowledge. We had not trained. And so now that they've been exposed, they've been trained, we have such a different outlook. It is so warming. It is just so, it's just, I don't know what the word is, but I'm just so grateful for that. And she had complete cooperation from the team. And that was wonderful. The whole thing was just a wonderful experience for us to have gone through. So I know I've taken up more time, Dr. Scott, than I should have, but I'm gonna give you my contact information. If you have questions, if you have ideas, you have suggestions, anything you wanna talk to me about, please give me a call. Emailing is great too. We're still working remotely and I don't misunderstand what you're telling me when you send me an email as opposed to what I write down from a note on the phone call, the message that you left me or during our conversation even. So you can reach me via email at Sharon, SHARON .banks, BANKS @RaleighNC.gov or by telephone 919-996-3077. Again, that's 919-996-3077. And I will get back with you as quickly as possible. If it's information that you need that I don't have, we have resources. We have 10 resource centers throughout the US. Those resource centers are there to service us in whatever part of the country we're in. We're in the southern part of the country, so we're serviced by the Southeastern Center, which is in Atlanta. So great resource. And if you can't get somebody in Atlanta, you can call any one of the centers you want to call and get the information you need to get. They have been a wonderful resource for me and continue to be. So without further ado, I give it back to you, Dr. Scott.
All right. Well, thank you very much, Sharon. Does anybody have any particular questions, one or two questions for her at the moment? But like she said, she will entertain any questions via email, and I'm certainly there are going to be those. But there's one that I have. This is in regards to the city's website. That has been an ongoing issue in terms of having a website that's fully accessible. And I understand the the complexity of that issue, but it is certainly one that warrants some type of response. And how is the city moving toward making its platforms and its sites fully accessible to screen readers for persons who are blind or visually impaired, or for the Zoom tech?
Okay, I cannot answer that as to what they're doing. I know that they're still working on it. Where they are now with it, I do not know, Dr. Scott. I have made a note of it. I will make it my business to find out where we are now and report back to you. That has been a concern for several reasons. So that's not news to us, unfortunately. I wish it was, but I don't wish it was. I wish it was perfect, but we are working on it still. I do know that.
All right. Does anybody else?
Yeah, Philip Woodward typed in the chat. He said that he attended the National ADA Symposium in 2017 in Chicago and in 2018 in Pittsburgh. Also attended in 2018 in Pittsburgh. It's a great event if you want to increase your ADA knowledge and consider obtaining your ADA coordinated certification.
And I'd like to say too, they are, and I left those days. For years, it's either been Father's Day weekend. It starts Father's Day weekend or Mother's Day weekend. Now that we've had the interruptions that we've had over the past 2 years and have done virtual training and what have you, they have moved it to July, and I'm sorry. I will give it to Lori to put the dates, the actual dates out there. They are actually going to have an on-site session in Phoenix, Arizona in July. They're also going to have a virtual session that will be held in August. If I'm not mistaken, it's the first week in August, and it's like the 20-something of July. But I'll get Lori those dates, and she can send them out to us. I apologize.
All right.
Dr.
Anybody?
I have a question. Ms.
All right.
Banks, my name is Robert Parrish. I'm president of the Wake Federation of the Blind. One thing that bothers me about the ADA is that businesses and other entities are allowed to meet minimal standards. I give the example of some construction that was done where I live. They both curb areas had places for wheelchair users to get out of a van. But only one area had a curb cut. My question is, what is the city of Raleigh doing to get beyond minimal standards of ADA law?
Okay, Reverend Parrish, may I go back? Was this on a city public property or was it private?
It was on city property. I live at Murphy School Apartments. It's senior housing.
Okay. And what area is it that doesn't have the curb cuts?
No, to be in full disclosure, they do have a larger area that's a curb cut, but at the end of one of the sidewalks, which is, it's actually a wheelchair ramp. At the end of it, there is a space where, with the lines, that's obviously meant for a wheelchair user to get out. But there's no curb cut, and I showed it to the manager of the complex, and she noted it, but she got back to me with an answer. Well, it's minimal standard.
That's
Okay,
key right there. So,
I will address that. I don't know. I know where you are referencing, but I'm not familiar with the layout there.
Well, it's on North Person Street, but my real question is, well, what is the philosophy of the city of Raleigh to get beyond minimal standards? You may know as well as I do, some businesses will say, okay, we hire people, but we only put them on the first floor. In other words, we don't give them an opportunity to have upward mobility with the ADA. As long as we've hired one person in that position, we're good.
I hear you. I don't know that there, I know that when we've done curb cuts and what have you before, when we've undertaken those, we've tried to do it according to what's in effect now. It has to be that, it has to meet minimum. But we try to go beyond that in every case that we possibly can. And it's not always possible to do that for
Why not?
many reasons. I'm sorry?
Why not?
Well, one reason is finances. It depends on what else is going on, how they're going to
Federal
develop that.
money.
I don't know if I
money.
have some, is there anybody else on the line from transportation that can answer that?
I think someone has just said something about federal money. When you deal with federal money, there's usually kind of rules and regulation. I heard Lawrence Carter say something about that.
Reverend Parrish, I have somebody contact you who can engage in that conversation with you. I will also find out myself, but in case you have additional questions, they can answer that for you.
Okay. Thanks.
Is that
for your
okay?
time.
and Mr. Parrish, feel free
That's
to give me a call.
fine.
Sorry.
All
I
right,
can give you some information on that.
thank you.
All right.
I have a
thank you very
question,
much,
Lawrence Carter.
Go ahead, Mr. Scott.
I'm with the Raleigh Wake Council of the Blind, and I would like to know, is there a possibility that we can have you as ADA coordinator come speak to our organization, because we have many more questions that we could entertain that we don't have time for here. So I would like to know, it every month, second Thursday, 7 p.m. we meet. Can I get you to commit to 1 month?
I will try to make that commitment, Mr. Carter. We've talked about this before, and I probably would, yes, we can talk about this again. Not here because we're taking up time for the meeting, but if you give me another call, I will dig into it deeper for you and we'll go from there.
Thank you very much.
You're welcome, sir.
All right. Thank you very much, Ms. Banks, for your time, and we appreciate that information. And we
You are
would
welcome.
appreciate having a periodic update on what's going on as part of our efforts at informing the community from the ADA coordinator's office. That would be a great thing to add to our agenda. All right.
Okay.
Thank you very much.
You're welcome. Thank you. Take care.
All right. Take care. Who has the time? I don't have a watch right in front of me.
About 20 minutes of the hour, Dr. Scott.
Okay. All right. Now we can shift back to to our normal agenda in terms of getting any types of committee report. Mr. Parrish, housing, do you have anything for us?
I do.
All right.
I am a part of the, as an advisor, I'm part of the North Carolina Weatherization Project or program. And we had a meeting last February, and it was through that I learned about new standards that's applied for persons who want weatherization as it applies to their income. I also asked May Hickman, who is the director of the North Carolina Weatherization Project, which is a part of the Department of Energy. It's a federal program, to be our guest at an upcoming Mayor's Committee meeting. She said that she would check with a colleague of hers to see if they both could not be present. So that's forthcoming. Also attended the Congregations for Social Justice's Housing Committee, and I learned many things, folks. One thing I learned is, well, there's this question. Why is the city of Raleigh tearing down houses or other buildings that could very well be used for low income or affordable housing? The mayor did address that question, and I don't exactly remember what was stated that she said, but that's one of the ongoing questions about our city, tearing down houses that could be used for low-income residents. Dr. Scott, that's my report.
All right, thank you very much. All right, do we have anything from the employer resource? Mr. John Samuels? Okay. I'm sorry?
Juan is not here.
Oh, okay. All right, then. What about transportation? Is Shakima here?
She is.
I'm here.
All right.
Beep, beep.
All right.
I don't have anything unless Donnie has something.
I haven't heard anything at this time now.
Well, that's
Okay. All right. Let me see here. Health and wellness?
And he's not here.
Okay. All right.
Dr. Scott, I'm
Yes.
concerned about him. He has not been here for several meetings.
Yes.
Is there anything going on with his health? Because I know that he has had health issues in the past.
Dr. Scott,
Yes.
before you answer that question,
Yes.
that is a private issue, and
Right.
that
Yeah, I can't answer that.
should stay off of this call.
Yeah, Robert,
Well,
I can't answer that.
Eric is correct. I was going to restate that. Let me rephrase it in a way. Is there? Well, I'm just going to leave it at that, Eric. Thanks for pointing it out, sir. He hasn't been here for a while, and I know that
Yeah.
he's had health issues.
he
So
does
Right.
periodically, and he doesn't have a computer and he has trouble logging into Zoom, but he does email me periodically. So I know he does have some health issues, but he's okay.
he's okay.
Okay.
Okay. Could he not join us by
All right.
phone?
That I can't answer for you. I don't know.
That's right. Yeah.
Maybe
All right.
he needs to understand, Dr. Scott, that he can join us by phone.
Well, we can.
We need to move on.
I know that, but I
we'll
also think
we'll
it's,
deal with that.
excuse me, I also think that it's important that I mentioned that because maybe he does not know.
But if he's not here,
Duly
then you're
noted.
still not going to hear it. So Robert,
Yes,
it'd be a
but
good
Eric,
idea for
somebody-
you to reach out to him, Robert. You call him up and talk to him
Well,
about it.
Well, also the chair of the committee could reach out to
Excuse
him
me,
as well
excuse
and
me.
inform him.
Excuse me. We'll take care of that.
Thank
We'll
you,
take
Dr.
care of
Scott.
that. So let's move to, are there any other reports from the committees?
I just want to ask Demetrius if the scholarship application did in fact go on the website.
It has not gone on the website yet. Let me continue to work on that. We're 2 staff people down right now. Marquita has transitioned away, and also Deja has transitioned away. So I am a one-man band right now. So continue to give me grace right now in this season because it's only me right now. So yeah.
Okay.
Okay.
Hey, Dr. Scott,
Yes.
this is Eric Dixon. I have a question for Demetrius.
Yes.
Demetrius, are you hiring?
Yes, we posted one position, and then we're going to be posting Deja's position within the next couple of weeks, by my understanding.
Will the position take in considerations persons with disabilities?
That it should. It should. I cannot make that call, but I will work on that. The job description has not been posted yet, but it should.
So Ms. Banks,
Now, the
will you
one
look
that
into
you
that
just-
as well?
Yeah.
Ms. Banks?
She's gone.
No, she's here.
Um,
Ms.
you
Banks,
say?
you'll look. I'm asking, will you look into that as well in terms of the positions that Demetrius has in his department, making sure that they are open to people with disabilities?
All the positions that will be posted going forward, including those two, will be looked at carefully to make sure that we're not requiring something that would prohibit a person with a disability to not apply. It's still on them to apply, but you can apply for any position at the city of Raleigh that you feel that you have the skills and
Well, let's
knowledge
make
to
sure
apply
we
for.
drop that must have a driver's license from that.
Okay, I talked about that earlier, Lawrence. And
Amen.
that is something that the city has looked at. I made that part of my report. And so I will take that back, Eric, and talk with them specifically about it. Thank you.
Thank you very much.
all right.
Thank you, Demetrius.
Mr. Edwards, you have a report for us?
Yes, I have just a couple of updates. Two already given, that Marquita and Deja has transitioned away. So it's me right now. So just hanging out with me as we continue to right this ship. Unity Day went. Yes, sir.
You said that you all have posted a position. When was this posted?
One position was posted, I want to say a little bit over 3 weeks ago, about 3 weeks ago.
Okay.
So one position was posted, and we're working to get another position posted. But due to the nature, we're in a hiring freeze right now. It's a little bit more complicated than just, you know, posting like we normally do. You have to get a couple of overrides.
Okay. All right. Well, we certainly appreciate that.
Oh, no problem. No problem. Lastly, the Unity Day event went well. Back in February, the end of February, it went well. I've seen a couple of you guys there, so thank you guys for showing up and being active. Within both events, we was able to reach 3,250 residents within Raleigh. The day of the event, we was able to reach 1,080 individuals through the drive-thru. So that went really well. So thank you for your support and leadership during that time. And also, I have one individual in the chat with their hand raised. If you would like, I can unmute them during this time as well.
Yes, go right ahead.
Okay, the first three digits is 624. Can you please unmute yourself?
It's Carolyn. It's Carolyn Covington.
Yes, that's Carolyn Covington.
Okay. Well, we don't have any questions at this time then.
All right. Now we can move into public comment period.
Philip has
We have-
information report to give.
Okay.
Yes, this is Philip. I would like to give my public information share report, if I may.
Sure,
I
go
want to
ahead.
clarify something that I said earlier when I was talking about the Developmental Disabilities Awareness event on March 25th. That might be geared towards City of Raleigh employees internally. So at this point, it's not something I need you all to advertise, but I will send more information to Lori as soon as I have that. But what I wanted to share for my public information report was that a woman named Pam Chance contacted me recently. She is involved in the Dix Park Master Plan and developing a plan for the Dix Plaza and Play that hosted a Zoom meeting yesterday evening. I don't know if any of you attended that, but she was looking for data on how many people with disabilities there are in both North Carolina and Wake County. and that there was a data breakdown by disability type. So I sent her some information for that. So I just wanted to let you know that that 6-part master plan is considering people with disabilities as they move forward. Also, one other thing I wanted to point out that I forgot to email Lori when I sent her my report was that yesterday, phase 4 opened for the COVID-19 vaccination. As of yesterday, anybody who has at least one health condition between the ages of 16 and 64 is eligible to go ahead and make a vaccine appointment. And that includes people with disabilities, including people with intellectual and other developmental disabilities who might not have qualified under phase 1. So a lot of people with disabilities are eligible to go ahead and get their vaccine now. So I wanted to share that information. Thank you.
Thank you very much.
I had a question. So anyone know, maybe Mr. Carter, anybody know of anybody who's giving vaccines, whether it's at a church or not? Because a lot of times that's an opportunity to get a shot. Because a lot of times they say if they had 200, maybe only 50 people show up. So I'm just wondering if there's anybody, because I know some people ask me how did I get around it. But I do know sometimes there's kind of like a public thing, and if you show up, there's a good chance you might get yours. So I was asking if anybody know anything like that. Mr. Dixon?
No, sir, I do not.
Oh.
No, I don't either.
Donnie, this is Robert. I just know that people just kind of hang out, you know, they may spend a good part of the day, and hey, if there's vaccines left, they're entitled to it.
Right.
Okay. Any other comment or questions?
If you have time to spend online, you can go to walgreens.com and put in, you know, your local zip code. And even though it might say there's no appointments within 10 miles for 3 days, if you refresh the computer, sometimes appointments become available. It's a very tedious process, though.
Thank you. That's a good one.
Okay. Any other comments? Well, what I would like to do is, before we adjourn, is to encourage you all, if you know of any other persons who might be interested in becoming a participant and or a member on this committee, feel free to pass that information to them and invite them. So we always like to have new people and new participants so they can bring their ideas and become a contributing member to what we're doing. Okay, do we have any other questions? If not, do we have a motion for adjournment?
Just a second, Ricky. I just want to ask who the person is whose phone number starts with, the last 4 digits are 8983.
Carolyn Overton.
Who's 0034?
That's Lawrence's.
Oh, okay. All right. Got it.
All right. Okay. Well, if this is all, nobody has any other questions or anything, we stand adjourned until our next meeting in April. Thank you all for coming.
Okay. This is Carolyn. I finally got muted. Thank you.
Thank you.
At the very end.
But it was a very good meeting. Yes, the very end. I've been on the whole time, but it was very good.
Great.
Thank you.
All right.
Thank you.